Hi, it's Kevin with Patient.dev, and we're going to continue our series on common myths about the FHIR APIs. Now, one myth is that FHIR APIs are for patients only. The patient access to the FHIR APIs is pretty well known because of the Apple Health app, that patients can log in and get their information, but the fact is that the FHIR APIs are for integration pieces, providers, and patients. Now, one way I like to describe this is with this slide, which we have the fast healthcare interoperability resources, or the FHIR APIs right here. And there are different personas that can access the FHIR APIs. So there's patient access, which is that the patient has access to their own data. There is provider access, which is that providers can access, you can make provider apps that access information about their patients via FHIR. And there's also system level access, which is integration access, which means that there is an outside system that is trying to use data it doesn't have, but to get that data through the APIs. So system level access, an example of this would be a radiologist who is reading x-rays and MRIs and CTs, and they may have something called the PAC system, which displays the images, but that PAC system may not have clinical documents or labs that it's able to access. The person who makes this PAC system could use system level access to have their app kind of make a network request to the FHIR server to request information on that patient and then display it natively in their UI. So this is kind of like a super user access, where there would be a super user username and password that the underlying system, the PAC system, would use to be a trusted entity accessing the FHIR APIs. I will stress that in most scenarios where you have system level access, your app, so if you're making this PACS, you're going to be responsible for ensuring auditing of the requests, because the FHIR server is only going to know that super username. So you're going to be kind of on the hook for all the compliance, whereas in provider apps and patient apps, those requests usually get logged in the standard auditing system. The other type of access that is not patient and not system is provider access. And provider access usually takes two forms. So one is that you create an app that is embedded in an electronic health record. So somewhere in the workflow itself, you have access to essentially a part of the browser that is like an iframe and can make your app appear alongside other content. So this is like a doctor is using their native EHR, and they click on a button and your app appears and calls the FHIR server and does something interesting with the data, like a growth chart app or a calculator of some variety. So this happens with single sign-on. So it's very transparent. It's not like the physician or provider has to enter their username and password. It just kind of transparently works, and most EHRs are set up to handle this use case. But provider access also allows apps to exist outside of the electronic health record. So on maybe a nurse's iPhone or a provider's iPhone, where you can be entirely off the hospital's network and have a provider log in and use data from the FHIR server in your app. Now, it should be underscored that the provider has to log in with like their username, password, and two-factor type stuff, so it's not as transparent as being in the electronic health record. It's a little, there's a little obstacle to logging in, which is because you're not in a trusted environment. But you can have an app that exists outside of the electronic health record or inside the electronic health record with provider access. So that's another common myth about the FHIR APIs, that they're only for patients, when in fact they're for system level integration pieces, provider access, both within the electronic health record and outside of the electronic health record. Thanks for listening to this, and check out our other videos on patient.dev as well as YouTube.